Well, good afternoon, everyone. We're glad that you're able to join us for our June Sleep Well and Respiratory webinar. This is a nice time for us to be together. My name is Justin Paiva with Health Products for You and Shop Nebulizer. I'm joined by Laura Castricone. She's our clinical advisor here at Health Products for You and Shop Nebulizer. If you're joining us live, welcome. We're glad that you're here. At the end of our session, there'll be time for question and answer. So if you have any questions related to what we discuss or any topic, whether it be sleep related or respiratory related, we have Laura here to help us answer any of those questions you may have. Laura, it's good to be with you again this month.
You as well. Thank you, Justin. Thank you. Welcome, everybody.
So you chose a really nice theme this month, Laura, the pulse on pulse dose. And it's really a deep dive, a discussion into pulse dose oxygen systems. You're going to help us with pros and cons of these different types of systems, especially related to continuous flow systems. So let's get right into our discussion, and we'll see if there's any questions at the end. So maybe you can help us right here at the beginning. What is the difference between a pulse dose or intermittent oxygen system and, as we talked about, a continuous flow oxygen system?
Thank you, Justin. So most patients that are on oxygen, if you have a system at home, the large concentrator that plugs into the wall, that's a continuous flow system. And what continuous flow system means is that whether or not that cannula is even in your nose, that oxygen is flowing, it's free flowing out of that unit constantly until the unit is turned off. So that's what continuous flow is. It means the oxygen is flowing regardless of even if anybody's on the machine or not. With the intermittent or pulse dose, it only gives oxygen to a patient when they inhale and not when they exhale. So because it does that, it lasts longer, but there are some contraindications. Now, in order for the machine to work properly, the intermittent flow, you have to have a good negative pressure when you breathe in. So people who can't generate negative pressure usually don't do well in those pulse dose systems because that's how they operate. Patient generates negative pressure by breathing in. It opens a valve inside the mechanism, which allows a large dose of oxygen to come out. They call it a bolus of oxygen. It's enough usually to keep the patient's oxygen levels nice and high. And when they exhale, they still have that residual oxygen in there because they got a huge dose on inspiration. And usually that's enough for certain patients. However, patients that have had very severe lung disease or end-stage lung disease or need high liter flows may not be a good candidate for an intermittent system because they have limitations. I happen to have a sample right here. This happens to be the Live Active 5 by Precision Medical, and you can see that it has 5 settings. So it means that in the pulse or intermittent flow, you can go up as high as 5 liters. Now, that's not equal to 5 liters coming out of a continuous system. Just so you know, they're not one and the same. They try to be very similar. However, that's why we encourage patients to be tested on these systems by a physician or in a rehab facility so we can get an idea of what liter flow they might need during different stages of what they're going to be doing. Are they going to be sitting around with the system on, maybe going to a child's house and babysitting? Maybe they only need 1 liter when they sit still, but when they get up and walk around or use the bathroom, they might need a higher liter flow. So these machines, the ones that work in the pulse only, you should be tested for them. Now, just to show you on this machine, all the machines have filters of some sort that need to be cleaned. These draw in room air to cool down the internal mechanism and to also help generate the oxygen. So these need to be cleaned. You'll see a lot of debris on these as well. These are all equipped with alarms. So if for some reason this unit were to be discharging too quickly or the battery life was low on it or the purity was not correct, you would get an alarm. And normally you get you'll get a manual with it telling you what each alarm is. It may indicate you have to charge it. It might indicate something's wrong with the unit, but these are pretty good workhorses. So they last a long time. A big concern that I've seen many times in the field is that people use too long of a cannula with the pulse dose systems. Remember, these have to sense you breathing in or negative pressure, the longer the tubing, the harder it is for the sensor inside this machine to evaluate that and be able to deliver that nice big shot of oxygen. So we do suggest they're no longer than 7 feet. I usually suggest 4 feet. And the reason for 4 foot too is that way it doesn't hang too low when you walk. The last thing you want to do is trip on it or get it caught in your wheelchair, a cane, or under your legs. You know, my mom was very short. If she were to use a 7-foot cannula, it'd probably be laying close to her feet, and I'd be worried about her tripping. The other thing I want you to notice, I don't know if you can see this on here, all cannulas, most of them are curved to some degree. A lot of people put these in incorrectly. So just as an aside, when you put a cannula into your nose, the curve goes down in the natural shape of your nares. If you put it the opposite way, it irritates the inside of your nostril and it'll rub. So make sure you put it with that. And you also tighten it up with your little bolero so that it doesn't keep falling off your face. So these systems are wonderful. They're nice and lightweight, and they're great to take for portability, but not everyone could use them.
So that's really interesting. You know, obviously Health Products for You Shop Nebulizer, we play this space, this continuum of care, so that it really requires us to work with our customers and patients to make sure that they're getting exactly what they need. So how does a person know if they can use a pulse dose system? What's the criteria?
So let me just say one thing, need versus want. Okay, and I've been doing this a very long time, and there's many, many times a patient will call me up. They've seen one of these systems on television. Their friend has one. They've seen it at pulmonary rehab, and they don't have one, and they wonder why. A lot of times I'll say to them, you know, either the company you're working with doesn't have them, or you need to be tested on it. And what we normally would require for someone to know if they can use this system is an order from the physician for someone to test them on it. Usually they're tested at a doctor's office. They could be tested by a nurse practitioner. They could be tested by a respiratory therapist. They do it in pulmonary rehab. And when I was working in durable medical equipment, we'd go out in the field and do it as a courtesy for the doc to give them an idea of what the patient needed with this system. A lot of systems don't work for some of the patients. And that's why need versus want. A lot of patients want these systems, but it doesn't fulfill their needs, and they're very disappointed. I want you to know, if you are an oxygen patient, there are many different intermittent systems out there. Some give a larger bolus of oxygen, some give a smaller. Your doctor will understand what your needs are, and it may be different than how you're using your continuous oxygen. So just to let you know, if you're right now sitting home on 2 liters of oxygen, when you walk around with one of these systems, it may need to be increased to 3 or 4, because as I said, it's not exactly equivalent to a continuous liter flow. So that's why we like you to be tested by a clinician or a physician to make sure that we understand your needs at all different times. What do you need when you're resting, and what do you need when you're walking around?
Yeah, it makes sense, because it may seem attractive to have a unit that is small and contained and easy to use, but it may not be meeting your needs. So obviously you're going to want to make sure that you work with your clinician, and that way you're making sure you're going to be cared for.
Well, I would hate to see someone make an investment of a few $1,000s for a portable concentrator, and believe me, that's a great price for portable concentrators. However, a lot of times patients will purchase them because they've seen them on TV or something, and then come to find out, they go to the doctor's office with it. The doctor puts a little pulse ox on their finger and says, yikes, your oxygen levels are very low when you use this, you can't use it, and they've made that investment. I don't want people to go out and buy something that they can't use, or they're only gonna be able to use short term.
Yeah, yeah. So, and that meets up with the vision of Health Products for You too. So we obviously want to be involved in that continuum of care and provide the right products to the right customers and patients. So one of the things we get asked all the time, obviously, oxygen through the night is a key question that we receive. So can a patient use a pulse dose unit for nighttime use, or with a CPAP or BiPAP device?
Well, no. There are some newer versions that have their claim to fame is that you can use it 24 hours a day, and the bolus is large enough to keep your oxygen levels up at night. And that remains to be seen. That's something your doctor can determine. In my past, and as I know as a clinician, most people do not breathe efficiently at night. They don't take deep breaths. If you ever watch anybody, sometimes it sounds like they're not breathing at all, even though they are, but they're very minimal. They don't make big chest excursions, and they don't use their diaphragm as deeply as they do when they're awake. Those things affect how these intermittent pulse dose units work. So obviously, if you're sleeping and you're not making a good effort, inspiratory effort, the machine's not going to deliver any oxygen. So it's not, that's why in people that are sleeping at night, a lot of times their oxygen level goes up and down all night long. They'll need a continuous system to keep that oxygen level elevated, because the last thing you want to do is that's a long period of time to be with low oxygen levels all night long. We don't like to see that. That can have a lot of detrimental effects. Now, as far as using it with a PAP device, that's contraindicated. What that means is it's a no-go. These machines, as you know, I just told you that they work by sensing negative pressure when you breathe in. If you're on a CPAP device, you know you have a long 6-foot strip of tubing. Even if you were to put the oxygen right up at the front of the tubing near your mask, it would not sense your inspiratory pressure in order to open the valve and deliver it through the CPAP machine. It just is not able to do that. So when you're using a PAP device, you unfortunately will need a continuous flow. If you have oxygen entrained into your CPAP or BiPAP, you'll still need a continuous flow systems. And the good thing is there are systems out there, portable oxygen systems, that are hybrids. They do both. They are both continuous flow and they do pulse dose or intermittent. And a lot of patients will purchase those or get those as their single freestanding system. But the thing you want to understand with that is they're a larger system. Most of the times, if they do have a continuous flow mode that has various settings, they're almost like a piece of luggage. They have a handle on them so you could pull them. That may or may not be appropriate for our frail little old lady or someone that has a wheelchair or a walker. Obviously, they can't be pulling and trying to maneuver a walker at the same time. So there's a lot of little different things that are involved in choosing the right portable oxygen concentrator. But first, you need to be tested to make sure you can use the intermittent feature on it, so that way you don't waste your time and money, and you don't get ill while using it. The last thing you want to do is end up having with these low oxygen levels end up in the emergency room because you're not well.
Yeah, that would be reverse of what we're looking for.
Absolutely.
We want good, healthy lives. So that's the key. So so say we've gone through all these qualifications and we get a green light from our doctor, pulmonologist, whomever we're working with. They give us the green light. They say, yeah, you're the perfect candidate, or you're a good candidate for pulse dose oxygen. So we're making our way through. We're making a decision on a unit that we're going to make a purchase. Obviously, Health Products for You is there in that process. They can reach out to you. You can help them get lined up with the right unit. But one of the questions that we get asked all the time, obviously there's a number of different manufacturers, and availability right now is an issue and things like that. But we've made a determination. One of the questions we get asked most is how long do the batteries usually last on a full charge on pulse dose?
That is almost an impossible question to answer for any particular person. I could give you like a ballpark. The reason for that is a couple of things. Manufacturers, when they test their systems, they test them usually on 20 breaths a minute or 16 breaths a minute. And when they give you the documentation of how long the battery lasts, it's based on a very low breath rate. I have to tell you, in my career, I've met very few people that have lung disease that breathe only 16 breaths a minute unless they're sitting still. So when they get up and walk around, if your breath rate goes up to 30 breaths a minute, that valve on this machine is going to keep opening and closing, and it requires battery life to do that. So the more often the valve opens and closes, the quicker the battery will go. So it's a very hard thing to tell somebody how long it's dependent on the manufacturer, obviously. You know, I would look at the manufacturer's guidelines, and we always cut that time down because it's dependent on a lot of factors. What's the liter flow you're using? How fast is your breath rate? Are you really going through it really quickly and opening and closing that valve very often? What type of system is it? Some systems have really long battery life. Some systems need to be recharged frequently. It really depends. It's a very hard thing to say. I recently had a patient reach out to me and ask me, How long does the battery life last in a POC? And my question was, what POC do you have? What's your liter flow? How much activity do you do? Are you short of breath when you walk around? There's a lot of factors that go into me being able to determine how long that battery lasts. So what I usually tell people is when you have a portable concentrator, monitor your battery life when you're doing different activities of daily living. So if you're home and you're doing some cleaning and cooking or, making beds or anything like that, and you're able to do those things, see how long your battery lasts, use it in your own home, get an idea of how long your battery lasts when you're doing something exertional, maybe shopping or, walking. And so you can get an idea, is this going to last me an hour, 2 hours, 3 hours on the charge? They all come with adapters to charge them in the car, but we have seen anomalies with that as well. Some vehicles, especially older models, are not able to charge these as efficiently as a newer vehicle. So that's something to bear in mind. We used to get calls a lot. Why is my unit not charging? And then we'd find out from one of our gentlemen who worked in the warehouse that was a car guy that there's just not enough juice in that particular system to keep this charged. So the big thing with units is monitoring your battery life and monitoring your usage. So and normally you're the same day to day unless you're brewing something. So if you notice that when you go shopping, you only get 2 hours out of a battery charge because you're really working hard, you're going to work hard on days when it's humid. It's harder to breathe when you have lung disease on days it's humid, so you might breathe heavier or deeper or faster, and that will also use up your battery life on your machine. So battery life is very dependent on a lot of factors. It's really hard to give you a fast and hard answer on. I can't say 2 hours definitively. It could be an hour and a half to 2.5 hours. It really depends. And we've seen them operate differently too. If you're, obviously, if you're in a very, very humid climate, sometimes they don't operate as well, but normally they're workhorses.
So we hit you with a trick question. There's
Yeah.
no one solid answer for it.
There's no one answer, unfortunately. I wish I could give you a better answer. What I usually say is go by the manufacturer's guideline, but cut that down. Sometimes we'd cut it down by at least an hour or so, just so that way you don't end up in a situation where you're out somewhere and there's nowhere to plug in. And now you're out of oxygen and you have to get to your car, you have to walk, or you have to do something like that. That could end up being a disastrous trip.
Yeah. Just an added question on top of that, would you say that a pulse oximeter would be something that would be just...
I encourage all patients, now the pulse oximeters when I first started as a respiratory therapist, you had to have a doctor's order for it. They considered it a invasive procedure, how I don't know, but that's how it was billed. So now that it's gone and you buy it in CVS, you can buy it off the shelf. I encourage anybody that has a lung disease or any kind of breathing problem to purchase a pulse ox. I have a pulse ox at home and I have asthma. And sometimes when I'm having a really tough time, I'll pop that pulse ox on just to do a trend to see if my oxygen levels are starting to go down or are they maintaining. I don't get worried about 1 or 2 or 3 point jump because that could just be movement of the finger. My finger could be a little chilly. So don't get hung up too much on that, but use it as a trending device. And if you notice that you're trending down and you're using one of these systems, it may mean you need to call your physician. That's the other thing too, is your needs can change over time. You may start out being able to use one of these in the earlier stages of your lung disease, and you may be able to use it the whole time. I can't determine that. Some people's lung disease escalates and it gets worse and they're not able to use the system anymore because it doesn't give enough oxygen.
Great. So now again, so we have that kind of answer,
Battery,
battery. So now we've made a determination of the unit, the manufacturer, what we really want to have, the features that we're looking for. What is required for me to go ahead and make a purchase of a portable oxygen concentrator?
Well, we'd love for you to purchase through HPFY, obviously, and we need an order from your physician. Oxygen is what they call a legend drug, so it's prescribed and controlled by the FDA. We need a prescription from your physician to dispense any kind of oxygen system. Now, if you're going to purchase one of these, portable systems that is pulse only or intermittent flow, please make sure you can use this type of system. They're not cheap, they're a little bit on the expensive side, but they're worth it if you can use this system. And that would be determined mostly by your clinical staff, whether it be your physician, if you go to pulmonary rehab. In pulmonary rehab, they usually have these systems, or they can borrow one from the manufacturer and actually test you on it and give the doctor that information so he could write the order. but we need to have an order to dispense it, and on there for your information should tell you how you're supposed to use it, because patients are very confused. A lot of times patients say to me, I don't understand how I'm supposed to use this thing. You know, sometimes it's different when you're sitting at rest, like watching TV and not doing anything. It's different if you have to get up and move around or take a shower or move your bowels or have company and you're speaking a lot. And it's different when you sleep at night. And that's the same thing with any kind of oxygen. And obviously you can't use the intermittent at night, but if you had a system that also did continuous flow, you know, the doctor would need to let you know how much oxygen he wanted you to use at night. So not only do we need the order to dispense it, but I would like your physician to put on there how he'd like you to use the oxygen. If it's 24 hours a day, 2 liters, then that's fine. But sometimes it's different during different periods of activity.
Yeah. And Health Products for You, we are very much in tune with requiring prescriptions and working with not only the patient, but if need be, we can reach out to the physician as well and make sure that we collect that information in advance of deploying the unit and sending that out to you. So,
and even with the demand that's going on with oxygen systems lately, we do have some in stock. Is that correct?
yeah, we do have a few units in stock portable, as well as quite a few stationaries. So if anyone needs any,
Feel free to reach out. Yeah, reach out to us so we can talk about what your needs might be, how to guide you forward. I just did that recently with a patient, letting him know what he should do before he purchased it to make sure that this was going to be the right system for him. So please reach out to us. My email is Laura, L-A-U-R-A, @hpfy.com, and you can ask me any kind of respiratory question that you need information on.
Yeah, great resource. We love having you here at HPFY, and
Thank you.
that makes it great for all of our customers and patients that are coming out to see us. We'll open the question and answer session now, Laura. In the meantime, if we get any questions, just a little bit of cross promotion for some of our other brands here at HPFY. We're really proud of our clinical advisor series. Laura is one of our clinical advisors, but we also this evening have a webinar 7 p.m. all focused on ostomy support. I think this month they're talking about ostomy supplies and how to deal with an ostomy in the summertime. So if you have any of those needs or know of anyone, please refer them on. They can go to our website and log in, get the login information, and just more clinical support presented by Health Products for You, our brands, just allowing for more and more options for our customers and patients to get answers to questions that come up. Sometimes are sensitive or difficult to get answers to. We haven't gotten any questions yet in the forum, Laura. We'll give everybody another couple moments here.
Sure.
Next month, we'll be focusing in on, every month we have these webinar series. Again, if you have any questions, you can reach out to Laura at hpfy.com, or myself, I'm Justin at hpfy.com. Real easy email addresses, nothing crazy there. So. Well, Laura, it looks like our audience today didn't have any questions. Again, this will be available on YouTube in the next number of days, or maybe even a week or so on YouTube. So it's always available as a resource if you want to go in and see if there was a point that you missed. You can always catch us on YouTube. But if there's no other questions, we'll go ahead and wrap up the webinar for June. And we'll see you in July, Laura.
Thank you very much. Thank you, everybody, for being here. And if you have questions, please reach out to me. I love helping. So if you need help, I'm here.
Yep. Always a great resource. Thanks again, Laura.
Thank you, Justin. Take care.